Sciatic pain. How did I get it, and how do I get rid of it? I'm Dr. John Gray, and I welcome you to our part 4 of our sciatic or sciatic-like symptoms, and how we can have some ideas to help you to get rid of those. Today, we're going to talk about number 4, which is SI joint pain. What SI joint pain is, I'm just going to grab my buddy here again, and SI joint pain refers to the pain here between the lowest part of the spine and the big pelvis bones here. When these guys get out of alignment, and there can be several reasons why they do. It can be lifting injuries are quite common for this area. It can be how we sit, and it can be also leg length indifferences too. And those are all things we can evaluate for and correct. So let's start at the number 1 here with lifting injuries. So when you get the body weight, as you notice here, this bone is triangle shaped, and it's meant to wedge down into this area. So the better it keeps that angle so that it can wedge, the better it works for you and the less effort it takes to stay in place. But when we move that wedge out of its normal relationship, as we get bent over, especially if we get bent over and the shoulders don't line up with the toes, that really gaps that joint and causes some torque on it. You can tear the ligaments in here and cause yourself some problems. So the best thing to do for that, obviously, is to get that adjusted back into place and kept in place until it can heal. There are some belts that you can wear around there to help take the pressure off until that heals, but of course it has to be in the right spot. The next problem that can happen when you're lifting and it can be tearing on it is if these muscles, like we talked about last week, the piriformis muscles, are too tight. So those stretches we showed you in part 1, if you go back to part 1, will help you avoid injury to this area when you bend and twist. Because if they're too tight, they anchor into here and they can pull and twist if you get too far on those without them being stretched out. The next issue here is leg length. So this hip hooks right into here, and depending on how it sits, even if it's a little off, that can cause torque every time you walk. It can give you a little duck walk, and that tweaks on that area and causes you lots of discomfort. How we evaluate that is we can measure the leg length, and the best way is we like to get in here and measure the hip heads through x-ray, and that'll give us our best idea that way. The other thing that can cause us trouble on this is our positioning and how we put pressure on this. So if our chair, that's why you see certain cushions with cutouts in them, as for this guy, because we don't want to push into that too much and be sitting on that. That'll spring these joints as well. Or if we lay on our side, and the big leg pressure out here, I'll turn this around, can flare that joint. And eventually, just through a lot of micro trauma, start to give you troubles. That's why we always recommend you have a pillow between your knees for this type of issue. Okay, how do you know if you have this issue? Well, number 1 is to get evaluated. But number 2 is generally it'll be easier for you to sit than to stand because you're actually supporting that joint and not letting any weight. This joint becomes full weight bearing when you're standing. And so if you have a hard time walking around very far, or you're getting a lot of back discomfort there, that's usually an indication of SI joint pain. So the best thing to do is to get that evaluated for, rule out the fact that if you have a shorter leg or not, and through x-ray, and then evaluate for what positions it might be in. And then make sure, what you can do is just to make sure that you're sitting and sleeping in a good position. So sitting, you want to have the back upright. You want to have at least a finger length underneath the front of the leg. And you don't want to cross your knees and don't cross your ankles because that flares the joint. If you're sleeping on your side, if you're a side sleeper, you want to have something with a little bit of cushion so you can take the weight through your side a little more versus having it all on the big pelvic bone. That'll cause it to flare. And then a body pillow or some type of pillow between the knees so it doesn't sit too low. Those are great things to do for the SI joint. Stay tuned. Next time we're going to go over some great posture ideas and help show you how we can help you with keeping a healthy, young-looking posture. Until then, have a great day, and I'll see you next week.